before I got diagnosed, I used to be very thin talaga. Thin, with regular menstruation.
Okay.
But late 2015, sometime around December or November, I was diagnosed with PCOS. That time ang PCOS, hindi pa siya basically well explained. Dito na si PCOS nag-strike sa health ko. Nung nag-start akong mag-breastfeed, tapos in-stop ko na lahat. As in, kasi syempre, when you're breastfeeding, hindi ka pwedeng mag-diet. Kaya din siguro, I started having hypoglyce, especially ng afternoon. Tapos, yung weight ko, as in, ang laki ko, I started gaining weight. Super drastic yung pag-change ng weight ko from size 2 to size 8. As in, ang laki. Tapos, ang baba na ng confidence ko. Sabi na ng mga brother ko, mukha na daw akong aparador, mukha na daw akong gasol. From the hypoglyco, drastic weight gain, meron pa akong migraine, chronic migraine. Mainit, malamig, never stress, ang sakit. So, binabasa talaga siya. Nahihilo na ako talaga, nagsushoot up yung blood numbers, 30s, 20-something, mga ganon. So, sabi ko, gusto ko ako din, kailangan, paglaki ng anak ko, mukha lang kaming friends. When I started using PPARS, first month pa lang, actually, first week pa lang, I started texting them na, Sir Shyan, Ma'am Jocelyn, I don't have episodes of migraine at all. Kasi yun talagang kita ko. Kasi everyday nafe-feel mo eh. Wala, even if it's cold, it's hot. Yes, kasi sabi lang, hirap daw sa doctors. Once you got diagnosed with DM or diabetes, it's really hard na i-reverse.
Exactly. How did your doctors react?
They were amazed yung OB ko. First time, kasi OB ko na sila before pa eh. So, first time, since
Simply Nature International and Simply Healed Medical Group, united by a shared mission to support healing through education and science-guided care. Simply Nature is an international distributor of nutraceuticals, has been studied for its role in supporting patients during cancer care, promoting metabolic balance, and contributing to overall cellular and immune health, including conditions such as hypertension, diabetes, and high cholesterol. The stalled kidney, when we talk about chronic kidney disease, we often focus on the numbers, the GFR, the stages, the levels. But behind those numbers is a story of cellular exhaustion. Imagine your kidney cells are like marathon runners. In a healthy body, they pace themselves and repair as they go. But in CKD, they are forced to sprint indefinitely without rest. Eventually, these cells hit the wall. They don't necessarily die right away. Instead, they become tired cells that stay in the kidney, taking up space but no longer doing the work of filtration. This is why healing feels so slow or non-existent. We aren't just losing cells. We are losing the endurance of the cells that remain. So how do we flip the script of exhaustion to endurance? This is where we look at the molecular level, specifically at PPARS or peroxisome proliferator activated receptors. Think of PPARS as the master metabolic switches. Within your kidney cells, when we activate these receptors, we are essentially giving the kidney a new set of tools to fight back. In CKD, the metabolic engine of kidney is broken. It can't process fatty acids or glucose for energy efficiently. PPARS help solve this in 3 ways. First, regenerating energy. They jumpstart the mitochondria or the cell's battery, providing the literal power needed for the repair of the cell of its own DNA. Second, preventing scarring. They inhibit fibrosis, the scarring that turns flexible kidney tissues into stiff, non-functional fiber. And third, very important, regulating inflammation. They act as a natural fire extinguisher, cooling down the chronic inflammation that usually keeps the kidney in the state of permanent damage. By targeting PPARS, we aren't just managing CKD, we are providing the cellular endurance required for the kidney to sustain its own life. The shift in perspective is the goal of tonight's webinar is to move away from the idea that CKD is just one-way street of terrible and continuous decline. If we improve or we can improve the endurance of a single cell, we can improve the function of the organ. Slower healing thus lasts longer if the healing is built on a foundation of cellular resilience rather than a quick temporary fix. The intention of today's webinar is to make sure we answer more questions coming from all of you for us to be able to empower you even more in your journeys. So without further ado, let's dive right in. Leading tonight's AMA are highly respected experts. First, it's an honor to introduce Dr. Jansen, a graduate of St. Luke's College of Medicine and diplomate of both the International Board of Lifestyle Medicine and Philippine College of Lifestyle Medicine. Currently serving as consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holistico, and Simply Healed Medical Group, where he practices integrative oncology. To be joining him today is, of course, our successful entrepreneur and seasoned international speaker who brings deep insight into personal health and success. He is the CEO and founding director of Simply Nature International and PPARS expert from Singapore, Mr. Shyan Lim. Good evening, Dr. Jansen. Good evening, Sir Shyan.
Good evening, Sheila. Good evening, Doc.
Hi, good evening.
Good evening, everybody.
It's nice to have the both of you tonight answering the questions of our viewers.
Yeah. All right.
Let's start. Okay, so for our first question for tonight, coming from Miss Mercy Mariano. Okay, can PPARS help with sciatica or nerve pain?
Oh, we've talked about this one before, right, Doc?
Yeah.
Yeah.
You have to first find out what the other reason why the patient has sciatica or nerve pain in the first place. Because sometimes you have this kind of musculoskeletal problem because the patient is too thin, the patient is sarcopenic, or if the patient has cancer, the patient might be cachectic. If the muscle of the patient, the muscle system, the skeletal muscle system of the patient is really diminished already, or if you have very low skeletal muscle mass, then you would have less structure supporting your bones now, which can cause a lot of spine problems. Now, PPARS will not address the sciatica itself, but it will address the underlying reason why you have this musculoskeletal problem in the first place. So if the reason why you have sciatica is because of if you'd have too little muscle mass, then PPARS. Now we have to first find out why you have so little muscle mass. If it is inflammation that's causing this diminished muscle mass, then PPARS can help that patient, because PPARS is really rich in fatty acids that stimulates the PPAR agonists, which can help lower inflammation, manage the metabolism, and encourage protein production in the body. So this is in other words, this is to stop the inflammation that's bringing about the low skeletal muscle mass. So if this is the case, then yes, it can. But if your problem is anatomic, say for example, you played sports, basketball, you just had an accident, then no. It's not the same as your mefenamic acids, your non-steroidal anti-inflammatory drugs. It's not the same as those. Yeah.
Thank
All
you.
right.
So
Sir Shyan?
to answer the question, yeah, to give a correct advice, then I have to see the patient, what's wrong.
Yeah, just did a quick search on research papers. So again, this is research papers, right? So to the particular patient, because ourselves as a company and have a consult with Dr. Jansen, I personally don't have patients, and our company doesn't directly deal with this issue of sciatica. So I did a search on research papers. So on research papers, it actually finds that key benefit identified by research is it can help with pain relief by acting on the spinal cord. It helps with nerve regeneration, especially PPAR gamma, all right, on the Schwann cell differentiation. So there is a particular group of PPAR agonist, PPAR alpha, which is actually shows that it can drastically reduce pain in patients with sciatic nerve compression. So again, all this is in preclinical and not even human, preclinical animal stages, right? So it's hopeful. We understand some potential mechanisms of action. So if you want to try, go ahead. If you want to try, especially you can have a consult with Dr. Jansen so that he can monitor your progress and perhaps also prescribe other pain management protocols to help you and to help you recover. So I guess the silver lining on the cloud is that yes, there is potential, and research has shown that there's potential for PPARS to help with your sciatica. So I guess that's a good sign for your current medical issue, right? That there's hope.
Thank you, Doc. Thank you, Sir Shyan. Well, as mentioned by Doc Jansen, for the person who asked this question, Miss Mercy, if you wish to have a consult with Doc Jansen, don't worry, we'll get in touch with you during the program by our caring healthcare specialist, Miss Beth or Miss Irish. Okay, for our next question, okay, thrown to us on the comment section by Miss Maitoni. Okay, I would like to know more about this product, not only for myself, but friends and family members in need of healing.
Okay. Okay, in general, let me give a quick brief. This if it's general health, metabolic syndromes, then go for our PPAR tablets. All right. So the PPAR tablets is a wonderful plant-based whole food supplement. So it's really you're eating vegetables. Okay. Now, what's so unique about this is that it contains small amount of PPAR agonists. The level of PPAR agonist here is more to maintain your health and to correct slight elevated conditions in your body, but you're not actually medically ill. Excuse me. So what are the things? What are the benefits that you can experience? Number one, it will help to regulate your metabolic syndromes. So we're talking about blood sugar, blood cholesterol. We're talking about hypertension. It will also help to manage inflammation, right? It will actually be very useful for boosting your energy level in your body as well, because PPARS actually works to preserve mitochondrial functions. So these are the mechanisms that we understand and that we have experienced through our patients and clients for the last 30 years. All right. Simply Nature itself has been distributing the product for more than 15 years now. However, the product actually has been around longer, right? Before this. Now, for those who want therapeutic effect because you have some medical condition, then definitely metabolic syndromes, right? It's very effective for metabolic syndromes. So blood sugar, blood cholesterol, hypertension. But hypertension has many causes. Okay, blood cholesterol, and blood sugar adds to that. So it can help. Now, for inflammatory issues, it will also greatly help, especially if you are suffering from chronic inflammation. If you're suffering from things like psoriatic arthritis and all that, joint pains, gout, CKD, yeah, there are many. You will probably need to go for the extracts, soft gel capsules, powder extract, or liquid. Now, which one to use? Simply write in, and our CSOs will help you. better still, have a consult with Dr. Jansen, and he will really address which dosage, which form of the PPARS and which dosage. Now, last but not least, let's talk about cancer. So for cancer, if you choose not to do oncological protocols, that means old age or sensitivity to chemotherapy or radiation therapy, whatever, then PPARS can be one of your, okay? Please take note, it's not the only thing that you would do to treat cancer naturally, okay? So if you're going to treat cancer naturally, you don't just take PPARS and do nothing else. So you got to combine it. And I just want to, I guess, encourage any person who wants to go fight cancer naturally. Please don't let anyone lie to you that buy one miracle product and that's all you need to do. Just take that one product. You know, even for our oncological protocols, for conventional medicine, they will combine, imagine, they will combine radiation therapy with chemotherapy, chemotherapy with immunotherapy, with hormone therapy. That they will not just use one approach, and they will, of course, include surgery. So they will not only use one approach. So it will be silly to think that in conventional medicine, you have to combine so many different types of approaches to have a good fight against cancer. And how can you simply, in the natural, believe anyone if they tell you they took one mushroom or one product and it cured them of their cancer? I think you've got to be careful because when you treat cancer, time is very important. So you want to use the right strategy right from the beginning. Because if you use the wrong strategy, then then the cancer will progress. If it progresses from one stage to another, it changes the whole game completely. That means protocols that would have worked for stage 2 will not work for stage 4. All right, so you gotta be aggressive about finding out. So for that, I would definitely encourage you to have a consult with Dr. Jansen where he can go through with you a whole wide range of approaches. But just to let you know, this is what PPARS can do. And for those who later realize that, or your children, or maybe your children is insisting that you go for chemotherapy, for example. And I know usually it's the elderly that don't like to go for chemotherapy. Then let me give you an encouraging thing, right? You can take the PPAR liquid. It will actually protect you from the more damaging effects of chemotherapy, specifically protecting your bone marrow and making sure your red blood cell count is up. Of course, it'll keep you energetic and and healthy, the rest of your organs as well. So that's a quick overview on how it can help you. Last but not least, this one, my own wife is a beneficiary of this. So my wife used to have eczema. So this is immunodeficiency. So if you have psoriasis and eczema, the tablets and soft gel capsules work wonders. Even lupus patients, right? So we have very strong lupus patient testimonies and results both here in Philippines, Singapore, and even in Taiwan. So I was very surprised because I thought only in Philippines and Singapore we had encounters with lupus patients. So when I went to Taiwan, I found out that no, across the years, over the last 2 decades, there have been many lupus patients who did well with the products. So just write in and let us know how we can help.
Thank you, Sir Sean. Dr. Jansen, would you like to add anything?
I won't. I mean, my answer is, what are you trying to heal?
Yeah. So I just took the opportunity to hit everything.
Yeah, so I'm good. I'm good. Next
Okay.
question.
I'd like to quickly add very, very quickly that, we are very thankful to doctors like Dr. Jansen who are studying
Yes,
about
we
our
are.
products. That is something that sets us apart from other, I guess, options that you may have because we have trusted doctors who trust our products as well. So, yeah. Okay, so just before we go to our next question, I'd like to greet our viewers for tonight. Starting off with Miss Maitoni Mendieta, Miss Helen Kamunayan from Baguio, hello po, Miss Noemi Veras, Zenaida Pentecostes, and Natalia Aquino. Thank you so much for watching us, and hope we could see you more in our future webinars. Okay, for our next question, coming from Mr. Lu, known to us privately, can PPARS help with fistula?
Oh, what's that?
Fistula is an
Fistula.
anatomic problem. You basically have a tunnel that's connecting 2 cavities. So, can PPARS help with a fistula? Simple answer is no. Because fistula, you have an anatomic problem. Yeah, so you have to repair that surgically. That's the definitive treatment for a fistula.
Thank you so much, Doc Glenn. Very straightforward. Okay, for our next question coming from Mr. Aurelio. What can you recommend for prostatomegaly 2?
Okay, prostatomegaly 2, I don't know what that is, but prostatomegaly is an enlarged prostate. Okay, so
Ah.
for an enlarged prostate, you have to find out first why the prostate is enlarged in the first place. Then you treat. Okay, so what I can recommend for a patient who has prostatomegaly, first find out if there are lower urinary tract symptoms like, dribbling frequency, nocturia, or, you keep on urinating at night. Then address those first symptomatically. Then you check an ultrasound. What's the size of the prostate? Are there any other organs that's affected by the enlarged prostate? So say for example, are the kidneys ballooned out? Yeah, are there any other obstruction that's there, no, aside from the enlarged prostate? Then you treat that. Now, for the prostate itself, there are a lot of treatments for that, like dutasteride and finasteride. The first line would be finasteride. So finasteride is it's basically hormone therapy. This is to basically shrink down your prostate again. Now, there are a lot of side effects with that treatment, like impotence. That's one which can, some males would be quite troubled by this because there would not be any flag ceremonies anymore, especially for those
Oh
who are
wow! So it's not
ill.
impotence; it's actually what's that called? You can't even raise it up.
Yeah, you
Erectile
can even raise
dysfunction.
it up. So it's a trade-off. So
Wow.
now, the treatment is not forever. So at some point, when the prostate shrunk already significantly, that it's not causing any lower urinary tract symptoms anymore, then you can be off the treatment already. So that's the case, then hooray, right? It was treated. Now, other other things that can increase the risk of a prostate enlargement would be insulin resistance, and this is where PPARS can come in to help lower the insulin resistance. Okay, and treat whatever metabolic issues you might have. Okay, being obese is also a risk factor for having an enlarged prostate. Okay, so you really have to check if you have any of these, then address the risk factors, check your labs, investigate further what are other things that's making the prostate enlarged, no? Inflammation can also make prostate become enlarged, no? And of course, the more sinister one is to rule out cancer, because cancer can also make the prostate enlarged. So my short answer to the question is to investigate further.
Mm. Yeah, we talk about prostate, and just now we talk about gut. I'm just I'm just doing some searches. So these answers are not actually simply nature answers coming from the company. It's really just what is out there in medical research. So what's interesting is that they find that PPAR gamma is also now coined as like a gatekeeper of the gut, right? So I did not know this before, but PPAR gamma is actually found in high concentration in the colon and intestinal lining. So in Crohn's disease, and why this came up is because just now for the fistula, Crohn's disease is actually one of the leading causes for fistula. So PPAR gamma actually helps to restore the gut barrier. Wow, that's interesting. It controls creeping fat. Yeah, it regulates how fat behaves. Wow. And when this is dysfunctional, fat releases inflammatory signals that make the disease worse. Then, of course, last but not least, this one we already know. Innate immunity. So PPAR research has shown that PPAR gamma is required for the body to produce beta defensins, which are natural antibiotics our body use to keep the gut bacteria in check. So this also brings me back to the importance. So a lot of the questions are asking like, can PPARS do this? Can PPARS do that? Me and Dr. Jansen are careful in telling you that to use this as a treatment, but there are so many mechanisms of action, right? that tells us that that's why I'm very glad I've been eating PPARS for the last 20 years already. So many people on our program also ask, what are the supplements you can take to help you keep yourself healthy? So it's very interesting that you're not just taking a multivitamin, you're taking this particular plant-based whole food that has all these wonderful functions, real functions in your body that keeps you healthy in many ways before you get sick. So I'm actually addressing as I share some of these things that PPAR Gamma can do. It's not so much to tell you that the product can be used for those diseases as a treatment. No. Because there's more research that has to be done. So we don't know the dosaging or how high a concentration level before you see a difference in your medical condition. But it does spur me to let everybody know, right? It's a wonderful supplement to take that helps keep so many functions of your body doing well. And for those who are taking PPARs for example, cancer or some other illness, it's also wonderful to know that it's also going to have all these other positive effects to keep you healthy. Yeah. Sheila?
Thank you, sir. Thank you. It's actually a call out. I'm a wife. I have a husband. I really have to make him healthy as early as now.
What?
Uh, the prostate concerns, we really have to, to be extra healthy as early as.
Yeah.
Okay. All
Actually,
right.
Doc, just before the program, Singapore's news is entire program on old people. And Doc Jansen is right. I want to tell everybody, Doc Jansen is right. Because it's a program, these 70-year-olds, 65-year-olds are told to go back to the gym and carry weights. This is what Dr. Jansen has been talking about. He actually talked about that. He actually said it's important, for the elderly, the senior citizens to because many questions about like osteoporosis, Dr. Jansen actually says, go and carry weights. Yeah, so it's really on the TV right now. It's actually shown as part of a news program. The two most important things for elderly. Okay, so if you are across 55, 60 years old, please listen. Two important things that Dr. Jansen has talked about. The first one, he really emphasizes, strength. You got to be strong. So doing weights is actually important, right? And if you can do it early, your body got a buffer that it can use to hold back the natural muscle degeneration that comes with old age. The other one is balance exercises. So I think like stand on your one leg, that kind of balance, the Tai Chi, turning left, turning right, is also important because as we grow older, falling, the thing that makes us really worried about parents, right? If they fall down. So balance and strength is very important to prevent yourself from falling down. So I want to say, Dr. Jansen, thank goodness I heard your advice. I've been doing weights. I'm not 60 yet. So Dr. Jansen is correct, guys? Yeah.
Thank you, sir. Thank you, Dr. Jansen. Okay, for our next question, coming from Miss Maricel, turn to us privately. The question is, can PPAR still help my Lola, who is 79 years old with high creatinine but refuses dialysis? She's also beginning cirrhosis and has edema on both arms and legs.
Okay. So I'm not a nephrologist or a hepatologist, okay? But in this situation, you have a problem with protein, okay? Albumin, I would 100% guess that the patient will have low albumin. Why? The liver, if it is already cirrhotic, that means, in other words, simpler terms, if the liver is already scarred, then the function of the liver would be diminished. One of the main functions of the liver is to produce albumin. Albumin is the protein that holds the fluid inside the blood vessels okay, to keep them inside the blood vessel. Okay, if the albumin goes down, so think of albumin like a magnet that magnets water. Okay, if the albumin goes down, so if you have less magnets, then the water will exude outside of the blood vessels. Then you will have edema. Okay, Another problem would be if the patient has if the patient already has, the kidneys are already destroyed, because one of the main function of the kidney is to keep the protein from leaking. Okay, so if you have a kidney that cannot hold in the protein and you have a liver that's not producing any more protein, guess what? The patient will have low protein, low albumin, and the water will now exude, go out of the blood vessel and produce edema. Okay? So the solution to this is to increase the amount of protein that the patient is eating or is eating from the diet. Okay? If the patient can still eat, okay, that's the thing. Now here's the problem. You cannot increase protein intake if the patient is not on dialysis.
Wow.
Because if the patient increases the protein intake, then that will further stress the kidneys and further drive the creatinine to go up. So you have now a therapeutic dilemma. Now, can PPARS solve this? I don't know. I honestly don't know. Because this kind of situation is already kind of like end stage already. It's end stage already. Liver cirrhosis is the last stage of before liver failure. Actually, it's in the verge of liver failure already. Okay? A patient who was already advised dialysis, you already have kidney failure. So you have two major organs that's failing already. And considering the age of the patient, then it's not a good sign. So will I use PPARS for this patient? Yes. I'll use the tablets because the tablets has protein. And hoping, since the tablets are also, it's also a chelator, the tablets, no, it binds things, so it might also help to bind the urea, the urea that the patient is producing. Okay, which might help bring down the BUN in the laboratory. So that's the urea, but it's not a guarantee, because how much tablets are you gonna feed the patient? Okay, I don't know. Might start with 10, 15, 40, 45. Yeah, we have to try. Okay, another thing is to give her uh anti-inflammatories, no? So I would try the soft gels if the patient can still swallow, but if the patient cannot swallow at all, or if the patient has shortness of breath, then you might want to try the powder, because the powder, the patient would just have to dissolve the powder under the tongue and not swallow. Because if the patient has shortness of breath, then if the patient swallows some things, no, some stuff, then that can risk aspiration. So that the thing that the patient swallows can go into the lungs, which is not a good thing. Okay, so that's how I would balance things out. But this kind of situation is really not good. If I were the patient, I would go for the dialysis, because the treatment that she is refusing is the one that's making her problem worse. The most pressing problem now would be the edema. That would be the most pressing problem, because if the edema is not treated, then her lungs can fill up with fluid, which, of course, I think you also, all of us already know that would be an emergency. Okay, and of course that can lead to infections, which can, considering the patient's age, that can, lead to um, yeah, hospitalization, ICU, etc. Another thing that we have to protect at this point would be the heart. Because if the patient is edematous, then I would surmise that the patient would already have signs of heart failure. So that's also something that we have to be wary of. So at this point, the patient should have a cardiologist on board already. Yeah. Yeah. That's my answer.
Yeah. So I can't help but also think, for your grandma, why wouldn't she want to go for dialysis? It's maybe it's the whole procedure. And it could be cost as well. So yeah, I just want to encourage you that at any point as your grandma opens herself up to making treatment, whenever whenever there's a positive outlook on that means improvement in her health, please spend more time with her. Yeah, this is the thing. When a loved one that is going through a difficult time and basically final stages, it could be years, right? But final stages, every opportunity where suddenly the person becomes stronger or clear of mind, that's the time you should take to say that last conversation that you needed to talk to while they are still clear. Because sometimes when they're not clear, you can't say what you wanted to say. So I just want to encourage you. 79 years old is a good age. So it's on one side is a very positive thing that your grandma has lived a full life, and I pray that you have many wonderful opportunities to create a few more great memories, be it the months or years ahead. Just wishing you and your family well. Yeah.
Thank you, Sir Sean. Thank you, Doctor. Very
Doc,
heartfelt. Go ahead, sir.
I wanted to ask a question. So when your liver fails, that's it, is it?
Not really, not really.
Oh, can a person survive with like
Liver failure has
Okay.
3 stages.
Okay.
Liver failure has 3 stages.
Okay.
So you have child's spew scoring. So
Mm.
the child's spew scoring would generally assess how well the liver is still functioning.
Mm.
Child's spew scoring. So you have child's spew A, B, and C.
Mm.
C is the end one. The end. If a patient is child's spew C, the patient would already be in the deathbed. Okay,
Okay.
that's really literally liver failure.
Yeah.
Child's spew B is somewhere in between.
Okay.
Child's spew A
Mm.
would be the liver. Although there are signs of failure, the liver is still trying to compensate for the failure.
Oh, okay.
Yeah, so that's child's spew A. Child's spew B is somewhere in between. Now, if the liver becomes decompensated, that's C.
Okay. So
Yeah.
in short,
Yeah.
a person cannot survive liver failure like kidney failure. Kidney failure, you have your dialysis, you have all that, right? But in liver failure, there's no alternative, right?
Well, you can have liver transplant, but
Okay.
liver transplant, I don't know if where you should undergo a liver transplant, no? If say for example, well, definitely if you have child's spew A, then liver transplant can still be done unless there are some conditions that's preventing liver transplant. Child's spew C would definitely be not anymore. I don't think child's spew C would still be a candidate for it or for an organ transplant because the prognosis is just that bad.
So everyone, take care of your liver. It is a very, very important organ in your body. In fact, these two organs are very, very important. I would say that they're almost as important as your heart and your brain, which is your kidney and your liver, right? It's really, really very important because in today's lifestyle, we are really damaging our kidneys and liver. All right, we know about heart attacks, right? We know about strokes, but just to let you to be mindful, our modern day lifestyle does stress our kidney and liver a lot. And if these two organs are compromised, life is almost not worth living. It's a very terrible struggle. So do take care. Do take care of your liver and kidneys. How can you take care of your liver and kidneys? Healthy lifestyle. All right, healthy lifestyle. And I'll plug it in. PPAR tablets. That's a simple way to keep. Doesn't mean you take PPAR tablet, then you can be reckless in your lifestyle. You can't. But if you have a healthy lifestyle and take Simply Nature PPAR tablets, then you will probably be doing rehabilitating your kidney and liver. Many of us don't have, many of us don't have a healthy kidney or liver. Okay, you may not have a failing one. You may not have one that is so sick that when you go for diagnosis, things are abnormal. But I'm quite confident to say many of us don't have a healthy kidney or liver. So a lifestyle change and PPAR tablets will put you in the right track to having a healthy liver and a healthy kidney.
Thank you, sir. Talking about being on the right track, as a mom, I think it's the high time for you to start off with your kids, you know, to have a great foundation for their liver also. Okay. All right. Coming for our next question, coming from Miss Vilma. Okay. Question is, which is better for myoma? 1 capsule a day or 30 tablets per day?
Ooh.
I will go for the extract, not
Yep.
the tablets.
Me
But
too.
here's also what I will check.
Mm.
Are there any toxicities? I mean, is the patient's environmental toxin exposure high? Makeups, personal care products. I would look into that. Cookware, yeah, environmental toxin exposure. If it is high, then I will first detox the patient. So in that case, then the tablets would be a good detoxing agent because it's a binder. It's basically used to clean the gut. And of course, I will not just depend on that. I would also use Cleansing Plus, um, coffee enema, infrared sauna, chelation, IV chelation. No, so I will also use those. Replenish your gut with probiotics. I will also do that. If the environmental exposure risk is really not there, then yeah, just focus on the extract. I would just use the extract. Now, the next question would be, is a single soft gel enough? I don't know. I don't know. Because for a myoma, my default go-to product would be the liquid.
Yeah, same here.
Yeah.
So everybody reacts differently. So why does Dr. Jansen and I recommend the liquid? Because the liquid is our strongest. So that means that's your surest bet that you will see a positive effect. Is it possible for some people to have very good results even just with the maybe two soft gel capsules twice a day? Yeah, it's possible, but it's like not everyone. So that's why we always recommend the strongest for therapeutic statistical hit. Yeah.
Thank you. So, Doc, it's not only the thyroid that gets affected pala with hormone disruptors. No, it's also, could lead to myoma also.
Yes, because myomas are sensitive to estrogen. If you have so much estrogen, you will get myoma. Yeah. So if you're exposed to endocrine disruptors, things or substances that mimics the action of estrogen, then yeah, you will have myomas. Yeah. Yeah, that's how myomas are formed.
There you go. Thank you. Thank you, Doc, for that information. Thank you, Sir Shyan. Okay. For our next question, turn to us on our comment section coming from Miss Natalia Aquino. May I ask if PPARS can be used as a food supplement in order to prevent from sickness?
Yes!
I have ulcer before, but now it's already healed.
Yes.
I want to try.
The answer is yes. Honestly, it's one of the best supplements you can take. It's one of the best foundational supplements you can take, right? If there's only one supplement you take, I would actually recommend Simply Nature PPAR tablets and vitamin C, right? Then you might take something specific. For example, if you're really lacking vitamin D and it's so deficient that you are actually having medical symptoms because of that, yeah, take vitamin D supplements, right, to boost it back up. But then I would still say Simply Nature PPAR tablets is really one of the best plant-based whole foods supplement that you can take, and it'll have so much impact on you. And if you were to do other things like eat healthy and take some specific supplements for some specific areas that you're concerned with, I think you have a very healthy anti-illness protocol that will keep you looking young, feeling good, and live longer.
Thank you. Thank you, Sir Sean. We have a lot of good questions tonight. Thank you. Thank you for your questions. Okay, for our next question, coming from Miss Del. My pap smear last year says ascus, but now it's saying follicular cervicitis. Can PPARS help either way?
I don't know. I don't know because usually for follicular cervicitis, the cervix is inflamed. Okay, so usually if the cervix is inflamed, you have to check if there is HPV infection or if there is a bacterial vaginosis, fungal infections, or if the bacterial vaginosis would be a very common reason. Now, the bacterial vaginosis is a result of an imbalance in the bacteria inside the vaginal canal that leads to this inflammation. So those are the things that I will consider. So yeah, those are the things that I will consider. Now, you have to ask an OB for this, or an integrative medicine practitioner, an OB that practices integrative medicine. That OB might be able to help with this.
Wow, Doc, I actually have I actually had another product which I don't know, we don't carry it anymore because it was something that my friend invented. It's actually the same inventor as AD Pro. So she actually invented a feminine probiotic. That means it's probiotics for the vaginal area to help restore what's that called? The microbiome of the female genitalia. So I remember she told me even for like during menses and discharges, the smell actually drops dramatically when they apply the probiotic. I think it is because the right bacteria is increased and is able to help the area readjust itself. So yeah, but we don't carry that anymore. So sayang. Doc, I have an interesting question I want to ask since this come up. Doc, there is no such thing as feminine wash in Singapore. I mean, we don't have that product. And actually, I have not seen that product anywhere else except in Philippines. Is there a and when I told my friends like in Taiwan in the medical area, they're like, huh? Why would you want to why do you want to sterilize or clean the female part? Because the bacteria microbiome there is actually very important. Yeah.
I don't know. I also don't know.
You notice, right? There's no such thing as feminine wash in other countries.
Yeah.
Yeah.
Well,
Have you seen it?
I haven't.
No,
Or I'm
really?
just not paying attention.
Yeah, that's true. That's true. But now that you're married man, maybe you will. But I don't know. But there's just something thrown out there because it was something very interesting. It's a very Philippine phenomenon that we don't actually have the rest of Asia. Yeah. And when I was in the US, I've never seen my female classmates and my sister studied with me, so I never saw her buy any of these things. Yeah, there. So just yeah, since this topic came up, okay. Yeah, let's quickly move on, Sheila.
Very good observation, by the way.
That's just
Okay,
a quick
but
shift.
first, before we go to the next question, just for you, for those who wish to have a consult with Doc Jansen, simply type in how to consult. Carrying Miss Beth and Miss Irish will definitely get in touch with you individually. Okay, for our next question, quickly, coming from Miss Leonida Kakuyong, can PPARS cure thyroid nodules?
Ooh.
You have to find out what the reason of the thyroid nodule is first. So I won't answer a direct yes.
So I wanna encourage you, go and have a consult with Dr. Jansen. He has some experience in this area and he has treated thyroid patients. So you might be the one where your condition can can be managed well. Yeah.
I totally agree. Thank you. Thank you, sir. Thank you, Dr. Jansen. Okay, next question coming from Ms. Fritzy. My sister is diagnosed with stage 4 breast cancer, but she doesn't like the taste of the liquid and powder. How many softgel capsules should she take instead? per
Okay,
day?
okay. 3. But I will tell you this, okay? I will really tell you this. Sorry, can I be brutally frank? Here it is. Come on, it's cancer. Taste should be the lowest of priority unless you are in the stage where you're saying we just want palliative. That means deal with this discomfort. If you seriously want to treat cancer, right? So any discomfort should be put in second priority. Now there are many tricks that you can do. All right. So let me give you a few tricks that will help you. So I would really encourage you not to downgrade simply because of the taste. If there were other reasons, maybe. So here's one trick. Squeeze your nose. All right. For the liquid, since you can't hold your breath too long, you can at least hold your breath and swirl in your mouth for 20 seconds. I'm sure you can hold your breath for 20 seconds or at least 10 seconds, right? So you will notice that when you don't breathe, that means you either squeeze your nose or you just hold your breath while taking the powder or the liquid. You'll notice that you can't taste the taste. All right, you can't taste the taste. Then immediately after that, you can take something that is easily helps you mask the taste of the product, right? So it could be, I think for us, the Chinese, we have a lot of like those preserved fruits, very strong flavor, just a little bit, and it is more than enough. Okay, so it's not for you to gulp 2 glasses of water after your liquid. Okay, just take something that has a strong taste, a little bit of it, and that should help you with the process. Yeah.
Okay, thank you, Sir Sean. Thank you, Dr. Jansen. Okay, for our next question, okay, coming from Mr. Vincent, from to us privately. Question is, can PPARS help with gallstones?
Oh,
Gallstones, not directly again.
No.
So the reason you have gallstones is because you have so very high cholesterol. And you're probably eating too little fat. Okay? So to address gallstones, you have to reduce cholesterol. PPARS can help with that. Since PPARS is a microalgae, it's a binder. So for gallstones, one part of the protocol would be the PPAR tablets. Then you have to take bile salts like ursodeoxycholic acid. That's the medication to dissolve gallstones. So you have to be on that as well. Okay? So that would be the combo. Then just eat healthy fats. Then that's it. So that this is to for you to flush out that bile inside the gallbladder. And hopefully the gallstones gets dissolved. Hopefully. Yeah. So that's how I would approach it. If the gallstones are still small enough and they're not causing any pain, then yeah, that would be my approach. But if it's already causing pain, then surgery is the way to go. Yeah.
Thank you, Sir Sean. Thank you, Dr. Jansen. We still have 2 questions to go. Okay, coming from Miss Natalia. Miss Natalia, by the way, is the person who asked earlier about the food supplement, if she can take it because she has been healed from her ulcer. So she's relatively healthy right now. And she says that your answers were amazing. And she's asking now how she will take the product or the tablets, how many per day.
Okay, since it's healthy, then let me, if it's a sick patient, I'll let Dr. Jansen answer. But this one, not sick, I'll take a step. Okay, this is what many of myself, I'm not sick, my friends, my family members, and my personal friends that I recommend to take the product for health reasons. That means just to be well, right? Just to be well, for a wellness reason, not because you're sick. I will encourage you to take 10 micro tablets twice a day for a month if you can, all right? If you can. The only reason why a person can't is for financial reasons, but I am quite confident that if you are willing to take supplements, I think 20 micro tablets for every day for a month should be fine. Okay, why recommend this, right? Because at 20 micro tablets a day, you should be able, even though you're healthy, you should be able to have some meaningful things that you feel. How many of you know? Many of us have taken multivitamins from the health store and we've never felt anything. I mean, literally, you don't feel any different when you take those multivitamins, but you take it because you know it's good for you, right? You know it's good for you. But you actually don't feel anything. So why I'm recommending this is I don't want you to just take 10 micro tablets and know that it is good for you. I hope that you will feel something from it. So what are the improvements that you can feel with 10 micro tablets twice a day for a month? After a month, there should be a general increase in your energy level. All right. You should also feel lighter. Why this lighter sense, this sense of lightness? Because some of your chronic inflammation might have been lowered. So there will be this lightness that you feel. You won't feel so feverish or get tired easily. For those who, okay, here's another one that I think many people will be surprised. I know in Philippines, when I lived in Philippines, I walk a lot. I walk a lot when I'm in Philippines, right? I walk everywhere. So if you ever walk up the mall, all right, or cross an overhead bridge after taking PPARS for a month, you should find yourself, you won't be panting. You'll find climbing up 2 flights of stairs, it's no problem. Last time you were, but then after taking PPARS for literally 1 month, you will find your general stamina actually go up. Okay. So other areas that you can find is general alertness improve. Even your skin complexion and the general radiance of your face. People who don't see you every day might make a comment like, hey, what have you done different? You look fresher. Okay. So this is some of the tangible results apart from knowing that the product is doing all the things that we discussed today about the mechanisms of action, from your gut microbiome to activating your immune response and all that. There are things that I think, practical things that a person wants to feel, right? You feel well, you feel better. So that usually comes with a higher dosage. Now, so after a month, when you start to feel well already, you can go down to the 10 micro tablets as a maintenance, and then increase it anytime where you feel that you've been working very hard, you're a bit under the weather, so you want more, and you can adjust from there. But I would want to recommend that you try 10 micro tablets twice a day for 1 month so that you can feel the difference, so that you will know, oh, there is a level higher than what you're having now of health. And I hope that you can experience that, because once you experience that, you will be encouraged to live a healthier life, right? If you are thin, you will stay thin. If you are fat, you say, I'm fat anyway. I can't fit into my favorite dress anyway. So let's enjoy the next ice cream. So when we experience some benefits, it gives us motivation to become healthier and healthier. Yeah.
All right. Thank you, Sir Shyan. Thank you, Dr. Jansen. Okay. There's one more pahabol question.
Last question.
Okay.
Being a little tired today.
I'll combine the two questions. You can answer in your own way. Okay. So the first question, what kind of foods to eat and not to eat by a cancer patient? And the
Oh,
next
wow.
one,
So
what is
Dr.
the dosing recommendation for someone who has osteoarthritis? Okay.
Okay, I'll answer the osteoarthritis first because that's short. You can't use it for osteoarthritis. Okay? You'd still be in pain because why? The problem is anatomic. The problem is anatomic for osteoarthritis. So the solution there would also be surgical. Now, here's some things that I use for osteoarthritis patients, some supplements. I use a supplement called piasclidine. So piasclidine is made from soybean oil and avocado oil. Now, PPARS soft gel and the PPAR liquid are very similar to these two oils because both are fatty acids. So I would try perhaps for osteoarthritis, I would try the soft gels. So how many soft gels in a day? I would go for 3. Okay, depending on the severity of the pain. Then I would also use Genacol. Genacol is a collagen supplement. So you're not limited with the
Mm.
brand Genacol, no. It's just that I use Genacol because it's practical. Okay, but you can use different brands from SNR. SNR sells a lot of collagen supplements. So NeoCell, U-Theory, whatever. Okay, you can. Now, aside from those supplements, I would also consider going for prolozone therapy. Okay, prolozone is where we inject a medicine. So that medicine consists of vitamins. It has lidocaine. It has a little bit of steroid in it. Um, the main purpose of that is to give enough nourishment to the area in the affected joint and to lower the inflammation in the joint and then inject ozone. Ozone's purpose is to lower the inflammation entirely and stimulate the restorative or the regenerative pathways of the body. So the main goal of prolozone is pain control. That's it. It's for pain control. Now, there would be a lot of doctors who would have reservations in the use of lidocaine inside the joint because lidocaine can it's chondrolytic. So chondrolytic means that it can affect the cartilages. So it can thin out the cartilage. Okay? So there are some doctors who have reservations in using lidocaine. But if you want immediate pain control, yes, lidocaine is an anesthetic. So that would immediately give you pain relief. Okay? So if you're not going to go for the prolozone therapy, then some patients go for exosomes stem cells. Yeah. So those are some considerations as well. Placenta extract injections can also work. PRP can also work. Okay? Now, the cost would now be dependent on your wallet because these procedures would now be, a little bit more expensive, especially the PRP, platelet-rich plasma, the exosomes, and the stem cell injection inside the knee. Okay? So, yeah, so that's my take on osteoarthritis. Now, for the foods to eat and not to eat by a cancer patient. So, you have to understand first what fuels cancer growth. What is the food of the cancer cells? So, the cancer cells have three fuels: glucose, cholesterol, and glutamine. These are the three. So, cholesterol is only obtained through animal food products. All animal food products. As long as you ate an animal that has cholesterol. Okay? Glutamine would now be richly found in animal food products as well. And a little bit of plant foods, but they're really, really rich in animal food products. Yeah, so that's glutamine. And glucose, of course, you already all know glucose, no? Processed carbohydrates, so that's rich, that's very, very rich in glucose. So the food that you have to eat now then would have to be very rich in fiber. It would have to be very rich in good fats. Okay? So those are the foods that you have to go for. Okay? And you have to avoid animal food products because you would get cholesterol and glutamine from them. Now, here's the thing. Animal food products, before if you've been watching my webinars years ago, I would be advocating for a whole food plant-based diet. Now I've changed my stance
Oh,
about it. Okay?
okay.
Yes, because a whole food plant-based diet would only be effective if the patient is obese. It would be effective if the patient is obese. Obesity is one of the drivers of cancer. Now, if a patient is thin already, very, very thin, then a whole food plant-based diet will not be in the best interest of that patient.
Oh,
Because the
wow.
patient would now be in a cachectic state.
Okay.
Going on a whole food plant-based diet would drive the patient's weight down. You need to increase protein intake. So
So avocados and lots of tofu
yeah,
won't cut it.
no, it won't. It won't. You need more. You need more. So here's the thing, though. So there's no one size fits all diet for a cancer patient. That's what I'm saying.
Okay.
The diet has to be tailored to the present condition of the patient. So I cannot answer what kind of foods to eat and not to eat by a cancer patient. I can answer foods that you should not be eating, but what foods to eat, it really depends. Okay, it depends. Now, what to avoid? Processed carbohydrates, processed meat, these things, no? Poultry, red meat, still, I still advise the patient to avoid them. But eggs and fish, I ask the patient, yes, you can go ahead, eat those two foods because you need protein. Okay, and this is especially if the patient is also have very high inflammation. Okay, and cancer patients would tend to have very high inflammation because the inflammation will drive the hypermetabolism. Then you will go cachectic. You will grow thin, really, really thin because your body will now be using your muscle mass and your fats as fuel. Yeah. So what to eat really depends on the current situation. And you might also need a dietitian, especially if you are trying to, rebuild your body. What I mean by rebuild is to try to gain weight. If you're coming from an underweight, if you're coming from being underweight or at a cachectic state, then yeah, you really need more calories. Yeah. So then I will not be limiting too many foods. Of course, I would be limiting still. I would still be limiting foods, foods which are obviously not healthy, but of course be I mean those foods should be avoided. You know them. I mean chips, ice cream, sodas, all these junk foods, no? There are also exceptions, no? Sometimes I also ask the patient, okay, you can go ahead and eat your ice cream, but only during chemotherapy infusion.
Okay, so it becomes a positive association. I get to
Yes,
eat ice cream every time
yes. Positive association. But, there's a mechanism behind that, no? So that's what we call as insulin potentiation therapy. So the insulin potentiation therapy, before, no, the doctors were injecting insulin when the cancer patient is infusing chemotherapy. So the main purpose why they're infusing insulin is to improve the penetration of the chemotherapy to the
Oh.
tumor. That's the main concept there. However, of course, there's no oncologist here in the Philippines who will do that unless you're diabetic, So, so what I advise the patient is tell the patient, okay, you just eat your ice cream. Anyway, the oncologists are allowing you to eat whatever you want. So let's take advantage of this. Eat your ice cream so that you get a glucose spike during the infusion of the chemo only. You get a glucose spike. Your insulin will also spike. So it's like you injected yourself with insulin. But
Oh,
so with the spike of the insulin, the tumor would now be the chemotherapy would now be able to penetrate the tumor better. So that's the concept, and you have the positive association, right? So
I can just
uh,
see it. Some of our more maculic cancer patients when they why are you eating ice cream? I'm preparing for my chemotherapy.
Thank
yeah,
I
you.
I just want to say, Doc Jansen said, Doc Jansen, so in general, it's still a no-no for like chicken, beef, pork for cancer patients,
yeah.
right?
In
In
general, I would
general,
still advise against it, but again, case to case basis.
case-to-case basis,
That's
yeah,
all. If you are coming from a very, very thin situation, you're very thin already. I mean, come on, you have to eat more. You have to eat
yeah.
foods. No, we should not be restricting for this. Yeah, but of course, no, junk foods are still junk foods. You avoid junk foods.
So you mentioned eggs and fish. I just want to say eggs are the gold standard in protein. So your pork and beef might have higher quantity of protein, but eggs are the higher quality because they are more biologically available. All right. So it contains all nine essential amino acids in the exact ratio that your body needs for muscle repair and growth, which is what's happening with the thin cancer patients. So, Doc, I'm so glad that you have now given your go ahead for eggs. Yeah, I'm gonna give it as an excuse. I love eggs. To eat more eggs every week. Okay, Ken. Thank
So
you so
much.
much.
Once again, so much learning from our two experts tonight. And it looks like we've covered all our questions. Thank you so much, Dr. Jansen and Sir Shyan. We're almost at the end of our webinar. As we wrap up, may I ask for a very quick parting words for our viewers for tonight? Like to
Yeah,
say?
I'll go first. So the things that we've tackled here does not constitute a consultation. Okay. You have to schedule a consult. I have to interview you, look at your labs, so I can make the right recommendation, a prescription, so to speak, no, which will fit your specific situation. So that's the correct way to go about it. So I hope you've with what little discussion that we've done here, you had a good understanding on what to do with your situation. So I'm here. If you need me, just schedule a consult. So that would be it for me. Good night, everyone, and I'll give the floor to Sir Shan. Bye.
Thank you, Doc. You know, Doc, you're actually looking very good for the beginning of 2026. Very fresh.
Thank
And
you.
nice haircut. Yeah, you do look good. All
I
right.
hope
So
I still look good at the end of 2026.
I was gonna say that you managed to keep your weight despite the pineapple tarts I gave you. So
I eat one a day.
oh, very disciplined. All right, all right. Okay, so like Dr. Jansen, I just want to thank everybody. And you know, the purpose of us doing this program is not for it to become a medical consultation. It's just that both Dr. Jansen and I, when we are talking to our clients and for Dr. Jansen, his patients, we just realized that many people don't even have some more basic technical understanding, right? So a lot of times we hear clients and patients a lot of hearsay from what they hear from their neighbors and their well-intentioned friends. And of course, on social media and from blogs, health blogs, there are some misleading information. It's not to say that the information is wrong, but it may be incomplete, right? And you notice even in our program, what we said 4 years ago, over the last 4 years, we have actually made changes to it. Why? As we deal with more clients and patients, we also learn and we get better. And also there are innovations in the industry itself. For example, last time chemotherapy is not the choice many people want to make because chemotherapy drugs 20 years ago did a lot of harm. But today, chemotherapy drugs are more targeted, right? So they don't do so much damage to the rest of the body. Then we have Simply Nature People liquid extract that protects you from the side effects of chemotherapy. That changes the whole game completely. So people who we would not in the past have recommended chemo, we will recommend chemo now because their sensitivity to chemo can be managed today, which it couldn't be managed 20 years ago. So things do change, and we hope this program gives you understanding. And you know, Dr. Jansen and I, especially Dr. Jansen, he has a strong passion for treating cancer. So he's always looking for new things. The last time when I was with him, we were talking about another very innovative way of treating cancer, but not available in Philippines. But we'll see in the next year or so. Maybe it will become available in Philippines, and during that time, we hope to be one of the first few people to tell you about that when it comes. So again, thank you for joining us. We're always looking forward to your questions, and we learn a lot together with you. So I'll hand the time back to Sheila.
Thank you, Sir Sean. Thank you, Dr. Jansen. Well, for everybody, thank you so much for your questions, and thank you for considering our program a program of value while you journey with your own health battles. And on behalf of our patients and our viewers tonight, thank you so much, Dr. Jansen Kalalan and Sir Sean Lim, for putting so much effort and care towards our questions, and of course, all of us tonight. Now, get ready for the best deals ever, because exclusive for website orders only, yes, you can still buy your PPARS liquid extract and PPARS powder extract with no shipping fees. Yes. So whether you are ordering from Metro Manila or anywhere nationwide, you can still avail the free shipping promo. Once again, this promo is only available via website. That's www.simplynature.ph. Now, if you've tried everything for your eczema or psoriasis or acne or even rashes for your babies and nothing sticks or nothing is taking effect, you need to try this. This is the AD Pro probiotic serum, and this is perfect for the said conditions. The buy one get one promo is still ongoing. So what are you waiting for? Most especially Valentine's Day is fast approaching. Okay, this promo is available via online Shopee and Lazada shops, legit Lazada shops. Now, you want to call our warriors, calling all warriors in the battle against cancer, whether you're a patient, survivor, caregiver, or health advocate. This is your moment to gear up and reclaim your freedom. Because coming save the date, this coming May 30, 2026, for our face-to-face seminar entitled Beyond Remission, Building a Body That Sustains Recovery, happening once again on May 30, that's 8 a.m. at the SMX SM Aura here in Taguig City. So please take the next step towards your healing journey with us here in Simply Nature. And please watch out for the future announcement that we will be releasing towards all of you so that you'll be better informed with the said upcoming events. There you go. So we hope to see you next week for our another episode of Simply Healed webinar. That's on February 12, same time, same day, Thursday night at 7:30 as well. So once again, thank you for spending your time with us. And this is Simply Healed webinar powered by Simply Healed Medical Group and Simply Nature International. By empowering your body through PPAR pathways to manage inflammation, you are building a resilient foundation for a vibrant year ahead. So please don't forget that your curiosity about your health conditions and your victories over cancer is what keeps us here in Simply Nature. Here in Simply Nature, we are always with you from start to finish. Thank you, everybody. Good night and God bless.